Hi, welcome to Drug Error Talk. I'm Matt Hamilton. Today we're talking about Xarelto, how it affects the human body, mistakes that can be made with it, how to fix those mistakes, and the consequences of not fixing them. I'm joined today with Doctor Jesse Garcia. Dr. Garcia, what is your area of specialty?
Well, Matt, I am a clinical pharmacist who specializes in drug interactions and the effects of those drugs on the human body.
Well, Dr. Garcia, what does Xarelto do in the human body?
Well, Xarelto is in a class of drugs called anticoagulants. You typically see those medications used for patients that have had surgery. They might be suffering from atrial fibrillation or a pulmonary embolism.
What types of surgeries would require you to need Xarelto to stop bleeding?
Well, what we would want to do, it wouldn't be to stop bleeding, it's to prevent the clot.
I see.
Okay, so these types of surgeries, we would see hip replacements, we would see shoulder, if you have shoulder surgery, or any other type of surgery where the surgeon would want a short-term therapy or potentially even long-term therapy where you are unable to form a blood clot or make it very difficult to.
Can mistakes be made with the use of Xarelto in the body?
Yes, we can see that from a number of vantage points. We can see it from the physician himself. The medication requires special dosing. So in the case of Xarelto, if you've had a surgery, you might be started on one dose, which is maybe a 15 milligram tablet twice a day. And then you'll take that for a few weeks, and then they'll switch you to a different dose. We call it a titration schedule. That is one place that we see that. We also would want to know whether or not that medication is dosed correctly in terms of either liver function or kidney function. In some cases, that can affect the dose that is given.
Okay. So back to titration, it's basically what, different drugs on different days, or different numbers of pills on different
Correct.
days?
So you might see you might take one tablet twice a day for 3 weeks, and that might be a 15 milligram dose, and in that case you would be taking a total of 30 per day. And then after that 21-day period, you would then switch to one 20 milligram dose thereafter. So when you get that medication, you have to make sure you're getting both prescriptions because you'll have to continue that therapy.
So it could be a different dosage on different days, or it could be a different number of pills on different days?
Both.
Both, okay. So a doctor could write the wrong prescription. Can the pharmacy make an error with Xarelto?
Of course. As with any medication, the medications have to be input into the system. So that's one place that it could be missed. The drug could be misinterpreted, meaning they think it says Xarelto, but it really says a different drug. And then if they get all that correct, the person actually filling the drug could also make a mistake and put the wrong tablet in there. A lot of the tablets look the same color.
Okay. Well, if the doctor or the pharmacy makes an error and you're the patient, what sort of consequences from Xarelto mistake could a patient expect?
Well, the drug's an anticoagulant, and so what you would expect in that case is you would expect to see some bleeding just because the body doesn't have the ability to clot as well as it did before. Xarelto targets a specific function in the clotting cascade, so it makes it a little bit more difficult to stop it, where if you had drugs such as warfarin, it can be treated a little differently. So in the case of Xarelto, it makes it a little bit more difficult to stop the bleeding.
Xarelto mistakes are more difficult to correct?
Correct.
Okay. So what sort of bleeding are we talking about, doctor?
You're looking at internal bleeding, you're looking at nosebleeds, you're looking at large bruising. Those can manifest themselves, if they're internally, as nauseousness. You might see blood in the stool. Those are types of kind of warning signs for the patient.
So, well, let's say you're a patient, and say you're getting a headache where you didn't usually have it, or a nosebleed, or blood in your stool, or it's just something's off. At what point should they ignore it, and at what point should they report it to their doctor?
Well, if you are experiencing symptoms of nauseousness, nosebleeds, and you've just had surgery, those are things that are going to require you to get in and get seen very quickly. What you'll want to do is bring in a list of medications to the office. If most likely you're going to go to the ER or some type of urgent care. bring that list and tell them if you are on a titration schedule where you are, because that will help maybe determine their course of action based on where you are in that therapy. So you'll want to do that and then obviously get seen as soon as possible.
Okay. So see the doctor right away and bring your list of drugs that you're on presently too.
Correct.
Okay. What if you're one of those patients and you ignore it? I mean, how bad can things get with this?
Well, you would expect internal bleeding to be able to manifest itself into whether blood in the stool, nosebleeds. Like we said, those were some of the consequences. Eventually, untreated, you could potentially pass away.
Do you in fact see deaths from Xarelto from errors?
We have seen deaths in the past from Xarelto.
Okay. Well, thank you, Dr. Garcia. It's been interesting talking with you on Drug Error Talk. If there's additional information people would want to see, visit our website at law-kc.com and also look to our YouTube channel. Doctor, we appreciate talking to you about Xarelto. It's been informative.
Thank you, Matt.
Okay.